Good morning. I'm Dr. Patient Luke. Sorry about the delay getting on.
No
We've been having
problem.
gnome problems recently, so I had to make a call. Pricing's ridiculous. You know how it is.
Sorry?
Anyway, what brings you in today?
Oh, I just had some questions.
About gnomes?
No, about birth control.
Oh, gotcha. Of course. Okay, so what do you need to know?
Well, I really just wanted to know what options there are out there and what would be the best choice for me. I'm not totally sure where to start.
Yeah, of course. There's a lot of options out there. There's a few that are a bit more common, so we can start with those if that works for you.
Yeah, for sure. That'd be great.
Alrighty. Well, the first that people usually think of is oral medications, just a pill that you swallow every day as prescribed. Pretty simple, pretty easy, very effective if you stick to the schedule. So you got those.
All right. And how do those work usually?
Great question. Great question. Well, so the pills contain hormones. Usually it's going to be estrogen and progestin, and those alter the menstrual cycle and will kind of mess with the conditions of the reproductive system so that you won't be able to support a pregnancy. So it can block ovulation, it can increase the cervical, the thickness rather of the cervical mucus, which creates a physical barrier. And it can also thin the uterine lining so that egg implantation is not possible.
Oh, okay, great. And then are there any typical side effects?
Yeah, pretty minor though. Nausea, headaches, irritability. If you notice anything going on, you can give us a shout and we'll adjust what type you're taking if needed.
Okay, gotcha.
Alrighty. Well, so another common category are implanted devices, and there's a couple types of those.
Like an IUD?
Yes, yeah, that's exactly right. The most common ones are inserted right into the uterus and release small amounts of hormones to alter the condition of the body, just like the birth control pills do. So again, like thicker mucus, thinner uterine lining, disrupted ovulation, that kind of thing. The benefit here is that these last years before they need to be replaced, and they are super effective. I mean, I have one, and I'm not pregnant yet. You know what I'm saying?
Oh, okay.
Yeah. Yeah, we like to have fun here. So,
Well, are there any risks with getting one?
well, yes, but very little. You might need some recovery time since the process is a bit more invasive, but it shouldn't last long. So you might feel some pain, lightheadedness, backaches, cramps, and then some light bleeding, but it should clear up with some rest. And, if you need some aspirin or ibuprofen, you can take that as needed. Be aware, though, on the off chance that you do become pregnant while you have an IUD, it will immediately be considered a risky pregnancy. So just keep that in mind. However, IUDs are like 99% successful. So it's extremely unlikely that you'll have to worry about that.
Okay, that sounds good. But I am unsure that is scary to think about. I think I'm still just kind of intimidated by that.
Completely understandable. Completely understandable. There's another similar option. It's called a contraceptive implant, which you might like better. It's a little flexible rod that's inserted into your inner upper arm. And it basically acts the same way as an IUD releasing hormones, but this time it's just progestin, and this time it's directly into the bloodstream instead of into the uterus. It doesn't last quite as long. However, one of the benefits is that if you can't use estrogen-based contraceptive methods, this one will still work for you. And 10 points if you can guess how it works.
Thinner uterine lining, thicker mucus, and disrupted ovulation.
Yep, those are the ones. Well done.
So are there any risks with the implant?
Not many. There's not many side effects. If you do end up feeling any, they should subside within a few months. Similar to an IUD, they have altered menstrual bleeding, headaches, acne, but it's the same thing where if they're still present after a few months, let us know. We'll get it fixed up. But something to keep in mind for all three of these. The first is that they may interfere with any other medications you may be taking. So make sure that before you get them done, you disclose that to your doctor or health provider so that you make sure that doesn't happen. And the second is that none of these protect against STIs. So you still need to be careful about those.
Okay, gotcha.
All right. Well, that's all I've got. Are there any other questions you have for me?
Not right now, I don't think so. Thank you so much for answering my
Great.
questions thoroughly.
Yeah, of course. I've got some handy dandy articles I can send to you on these options, and then if you have any more questions, we can set up. The gnomes are back.
Oh, what? Really?
The gnomes are back. I'm sorry. I've got to cut them short. It was great talking to you. Please keep an eye out for those articles and then give us a shout if you need anything else.
Okay.
You have a
Do you
great
need any help?
No, I'm a professional. Don't worry. Bye bye.